are just a couple weeks from Christmas and we all have a lot going on, but one thing we cannot forget about is our health. There's a lot of food and drink this time of year and a lack of sleep. Today we have Dr. Thomas Boyden with Spectrum Health's Cardiovascular Services team. And so we're going to focus on our heart for this interview. And you know, we all hear about heart attacks, but what exactly is happening in the body medically when we have a heart attack?
Yeah, so really what we're talking about is a lack of blood supply to the heart. And whether that's because a blood clot forms in one of the vessels or you've really kind of limited the blood flow to one of the vessels, it really puts your muscle tissue of the heart at risk.
And of course, this is the time of year where we're trying to do everything.
Absolutely.
And especially in these last couple weeks before Christmas and 3 weeks before the end of the year. It's a lot of strain. And so what are the symptoms of having a heart attack?
Yeah, the most common symptom by far is chest pain, and that can be categorized a little bit differently for everybody. We kind of think of it more as chest pressure, kind of right underneath your sternum. It can come up into your neck, your jaw, your shoulder, your arm. Some people describe it as something sitting on their chest, like an elephant on the chest. Some people describe it as a squeezing sensation or tightness to their chest. But other people have kind of less classic symptoms, and they can have just sudden onset shortness of breath. They can be extremely fatigued. They can even become nauseous. And so those are somewhat vague symptoms, and it's harder to figure out, is that my heart, is that something else? But if you have risk factors, it's something you want to take seriously.
Yeah, and I could think that this time of year, a lot of people are under pressure. So they're saying, ugh, I've been tired lately, you know, that's to be expected this time of year, but you should listen to your body.
Yeah. We often think of the holidays as a very happy time, but it's not for everybody. And like you mentioned, it can be a very stressful time. And stress can play a significant role in the risk for heart attack. You know, if you're not sleeping well, if you're eating too much or the wrong foods, you're drinking too much of the alcohol. Maybe things at home, you know, aren't the greatest this time of year because of the loss of a loved one. Maybe politics in the family, you know, all of those things play a role. So it's not always a happy time. It can be a stressful time.
So what is recommended if you think you could be having a heart attack? What should a person do?
The most important thing is get to the closest emergency room you can get to, and whether that's by calling 911 and getting there by an ambulance. If you have somebody that can get you there quickly, we recommend that. We never recommend driving yourself because if you're having a heart attack, you could pass out. So we don't want you driving yourself if you think you're having one.
How important is time in the whole mix of things, and whether you get medical assistance right away or if it's delayed because you're thinking, oh, this probably isn't anything?
Yeah. So time is of the essence. You know, you can't stress that enough. The longer your heart goes without blood flow, the more damage there will be done. And so if you lose that muscle tissue of the heart and it becomes scarred because you don't have blood supply, that scar is a permanent thing. If you get to the hospital quickly and we can do interventions quickly to get that blood clot out, restore the flow, you save the muscle tissue. So you could have a heart attack and have very little scar, if any.
So are more people likely to have heart attacks during the holiday season?
You know, that's a great question, and so the short answer is probably, you know, because we have some studies that have come out of Europe that retrospectively look at data. So they've looked at medical records from previous 15 years, and they're trying to find associations with heart attacks and holidays. And what they found is that the risk of heart attack is higher around Christmas Eve, Christmas Day, and the day after Christmas, as well as New Year's Eve.
Interesting.
Yeah.
New Year's Eve.
New Year's Day, I'm sorry, New Year's Day.
Yeah, you know, it is interesting now. We are having lots of fun. We're doing a lot of things. We hope that in January there's a renewed focus, and we know that it is often on good health. And then in February, a big focus on our hearts too coming up. So it is the time of year where we really need to be thinking about those types of things, not just for us, but our loved ones too. Because sometimes that's not always top of mind for people.
Yeah. You may not have symptoms yourself, but you might notice it in a family member. You've got to kind of be aware of what people in your family's risks are for heart disease. You know, certainly the older you are, the higher your risk of heart disease is for anybody. But if you have things like diabetes or high blood pressure or high cholesterol, those are also risk factors. The same study that came out of Sweden saw that people who are over the age of 75 and are diabetic are actually at the highest risk of heart attack around the
In
holidays.
genetics, too.
Absolutely.
I mean, if you have a family history of your parents maybe having problems.
Absolutely.
You're thinking about that, or you should be thinking about that,
You should be
too.
thinking about it, absolutely.
Yeah. Well, thank you, Dr. Woody. We really appreciate
absolutely.
you
Thank you.
stopping by, reminding this of us, and keeping us very mindful for ourselves and our loved ones this time of year.
Thank you for having me.
Yeah. We'll be right back with more 8 West. Don't go away.